recording.
Okay. Greetings and welcome to this panel discussion that's focused on advanced technologies and in particular the use of artificial intelligence in addressing cancer disparities across Africa. I am delighted to have here with me three very distinguished and inspiring leaders who will be sharing their perspective. My name is Irene Danko-Mullen, and I have the honor of chairing and moderating this panel. I am a physician, industry consultant, and a scientist working at the intersection of technology, data science, and innovation that includes decision support tools, AI-enabled management tools, clinical decision. And I serve as the Chief Health Equity Officer at Merative, which is formerly IBM Watson Health, and I also serve as the Deputy Chief Health Officer. I am really excited about this panel. We have a lot to talk about. We're going to talk about innovation technologies that are already being implemented in Africa. We're going to highlight some of those technologies and how they're being used in cancer care and outcomes. And as part of the discussion, we'll touch on some of the challenges of implementing these AI-driven technologies or scaling it, the challenges and, policies a lot, and what is needed really to help fund the growth and scale of these technologies. So our distinguished panel today are Dr. Kingsley Indo, who is founder and chief strategist of Huron AI, a startup company leveraging artificial intelligence to close the deficit of oncologists and patients in sub-Saharan Africa. He's also clinical faculty at the University of Washington Department of Global Health and an affiliate member of the Fred Hutchinson Cancer Research Center in Seattle, Washington. Welcome. Next, we have Professor Isaac Adewale. He's a gynecologic oncologist and global health policy leader. He's the immediate past Minister of Health of Nigeria, founder and chair of the African Cancer Coalition, and a past president of the African Organization for Research and Training in Cancer, also known as AORTIC. Welcome to you as well. And finally, we have CEO Leo Romanowski. He is founder and CEO of Spartans Technologies. He's a serial entrepreneur, a keynote speaker who has extensive experience in artificial intelligence, augmented reality, virtual reality, and expertise in leading innovation processes in large organizations. And welcome to you all. I would say they're both from different, so Dr. Kingsley Indo is in Seattle, Washington. Professor Isaac Adewale is in Nigeria. And Mr. Leo Romanowski is in Israel, and I am in Bethesda, Maryland. So this is really a global team here. Thank you. So welcome to the three of you. I'm just going to jump in and I'll start with Dr. Kingsley Indo. Why don't you start us off with a general overview of gaps in cancer control in Africa? We want to set the stage for the burden of cancer in Africa and the disparities that we're seeing. What are some of the statistics? We're going to talk later about the statistical capacity for AI and AI-driven technologies, but start us off with sort of the overview. Thank you.
Thank you so much, Irene, for that kind introduction. I'm really excited to be here. As we know, cancer is a global health challenge, and Africa is not left out. The GloboCan, which is an organization based in France, the International Agency for Research in Cancer, do collect data from several countries every 5 years. And the latest data in 2020 shows that 1.1 million new cancer cases were diagnosed in Africa in 2020 alone. And unfortunately, 700,000 of these cases died, which is really sad. And each of those deaths represent families. They have brothers, sisters, their husbands and wives, and it's really devastating. So one major gap we're seeing in sub-Saharan Africa is the fact that most of the cancers that are diagnosed, the 5-year survival rates are really low compared to what we see in Western countries. And unfortunately, this is projected, the deaths in cancer in sub-Saharan Africa is projected to increase by at least 70% by the year 2030. And so in this kinds of situation, we need adequate health workforce, we need the adequate numbers of oncologists to tackle this problem. And unfortunately, we only have one oncologist to 3,000 cancer patients in sub-Saharan Africa. If you compare that to the United States, we have one oncologist to 187 cancer patients. Now, this has a lot of impact when it comes to patient care, quality of care. Patients need a lot of support during their treatment, and we have very few oncologists that can take care of these patients. The other major gap we have is funding. Most African governments are struggling to fund several sectors of the economy, and healthcare sometimes do not get a good percentage of the pie of their budgets. And so there have to be innovative ways to fund cancer control, from prevention down to treatment and follow-up. And another major problem and gap we have in sub-Saharan Africa is late-stage diagnosis. Breast cancer, for example, in sub-Saharan Africa is 67 studies, a number of studies have shown that 67 to 92% of cancer cases are diagnosed late. And the best chance for cure or to have the best outcomes essentially is when you can detect the cancer or when you can diagnose early. And there's a plethora of other problems, things like access to innovative medicines, access to data gaps. Cancer registries there's a paucity of population-based cancer registries, and without the data, we can't really make informed decisions or drive the kind of treatments that are more personalized and more effective. And that's why I'm excited about this panel, because we're going to be talking a lot about data and how we can close that gap and how we can leverage AI to accelerate a lot of the progress that is also being made in the sub-Saharan African continent. Thank you.
Terrific. Thank you for that overview. Very, very important. So I'll turn it over to Professor Adewale. You've been at the forefront of promoting cancer care, cancer policies, advocating for high standards of care that is reflected in the science and practice, right, or relevant to the African continent. Throughout your work, your leadership with Aortic, tell us some of the work you've been doing in the space, and what are some areas of opportunity that you think AI can help to improve cancer outcomes?
Thank you so much, Irene. Cancer presents unique challenges to us in Africa. Apart from the burden, which Kingsley mentioned, we're also worried about the case fatality. Whereas the case fatality globally is about 50%, for Africa, we're talking about 64%. And since Africa is a young population and we're just going through a transition, it's also expected and computed that there will be about 90% increase in the burden of cancer in those who are age 60 and above over the next 10 years. So this, to me, represents quite some serious challenges that we should tackle within the African continent. So in 2016, Jackson Oren, who is the director of the Ugandan Cancer Institute, and myself at the World Cancer Congress in Paris, decided to take this challenge head on. We decided to form an alliance. We call it African Cancer Coalition, with a few other cancer specialists to look into the real challenge that we face in Africa. We quite recognize that a huge challenge will be to standardize treatment and make sure that what we offer our people are treatments that are comparable, of good quality, and that we can defend anywhere. And we also recognize some of these challenges, the absence of national cancer control plans, dearth of human resources, lack of training, and as mentioned by Kingsley, the gap in human resource available for cancer treatment. Whereas there's about 3,000 patients to one oncologist in Africa, compared to about 1 to 180 in US. So we really needed to do something quite innovative. So we gathered ourselves together, and thereafter we formed the African Cancer Coalition. And the Cancer Coalition has actually been meeting twice yearly since 2017. We've had meetings in Nairobi, in Kampala, in Abuja, in Accra, Lusaka, Addis Ababa, before we went virtual in 2020 for obvious reasons, the COVID era. But so far, it's been tales of success. We've been able to build multidisciplinary teams of surgical oncologists, medical oncologists, radiation oncologists, hematologists oncologists, gynae oncologists, pediatric oncologists, pathologists, palliative care specialists, and medicine specialists. So far, we've been able to put together about 110 cancer experts from 31 cancer centers. In addition, we also have supported by 19 experts from the NCCN Guidelines Committee. So far, what we've done is to actually look at the NCCN guideline and created some what we call color coding. When the coding is black, we say this is the standard of care. And when it is gray, we said this is a treatment of care that is top grade, desirable, but which we cannot afford for now. When it is blue, we think this is something that we can afford to offer in Africa, which every country in Africa should aspire to have. And when there is a strike through, we think, well, this is really high tech of the greatest order. So far, it's been tales of success. We virtually succeeded in revising 51 of the NCCN treatment guidelines, 30 site treatment guidelines, 3 screening guidelines, 7 supportive care guidelines, and 2 special population. Our next meeting, the first face-to-face in the last 3 years, we'll hold in Tanzania in October, where we also plan to revise 2 or 3 additional guidelines in order to increase the number of guidelines. I think the real challenge that we have is how to really partner and transfer this using technology. It is one thing to have a guideline, it's another thing for you to apply technology. We tried to work with IBM, this fell through. So to me, that's a window of opportunity to leverage new partnership, to transfer these resources to the clinician working at offline sites in a way that we can improve quality of care. So that's what we've been doing so far, and we're quite excited about this, and we are quite open to new partnership following the abortive partnership we had with IBM. Thank you.
Yes, thank you so much. I think it's really important, like you said, to make sure that there's harmonized, right, cancer treatment guidelines and establishing sort of a way to integrate and institutionalize these resources for patients with cancer in sub-Saharan Africa. Thank you for that. And we'll come back to that because that's very interesting. I want to go to our Leo Romanowski. You are an entrepreneur. You've made investments in the space. We know that the global investment in advanced technologies, especially artificial intelligence, has skyrocketed, with most investment being spent on research and deployment and implementation. And even though the large techs such as Google and IBM, as mentioned, have dominated that space, there's still private investors like you, your company, that are jumping in and helping. And so based on your expertise, how can African companies or institutions leverage these global capital flows in AI startups or research, and you know, sometimes we think the success of mobile phones, IT communications across Africa maybe is an indication of possibilities of what's to happen. So tell us about it, and in a way, I think Professor Adewale is also looking for collaboration and how to really build on the success so far. Over to you.
So thank you, and the amazing colleagues here for inviting me. So first of all, allow me to say that I'm not coming purely from the medical sector, and that kind of allows me a much broader view into innovation and what works and what doesn't work in the medical sector. And sometimes what we see is that innovation is stalled or going really slowly, specifically in medicine. Yes, there's innovative things, but in the end, there are many challenges. We will talk about them, I assume, in the second half. But maybe to give you a glimpse of what's happening right now in medical innovation as a whole, a couple of really quick stats, because everybody likes numbers. First of all, in 2021, the overall investments in the medical tech was around $40 billion. That's a lot of money that went in. And more than that, there will be an increase of 30% of investment year over year in the next 7 years. Why? First of all, during Corona, things have changed. Suddenly, institutes that were very classic institutes understood the importance of digitalization and pushing new technology like artificial intelligence and other technologies to support the crews, the doctors, the nurses that, let's say the truth, suffered. They were overworking, they were working very hard, and in the end, I think that in majority of countries, there were significant understaffing. So Kingsley, for example, was referring to the fact that if we look at the world of oncology and cancer, we have more and more patients because the general population is getting older and older. You know, medicine is getting better, so people are living more. So of course, the percentage of, or not percentage, but the number of cancer cases is just increasing. And on the other side, we don't have a proportionate growth in number of oncologists or even doctors. And even if you have growth, is it the same level of doctors? That's a question. And here, especially in places where we cannot scale humanity. You know, it's very hard. You need to invest significant amounts of it's generations over generations that we need to invest. And unfortunately, it's not very quick. So for us, it's very important to look at a couple of factors. First of all, we talked about Africa. Africa, it's critical to implement technologies like artificial intelligence and virtual reality and digitalization platforms, just from the simple reason of understaffed. There's not enough doctors in the entire continent of Africa in order to support the population. And we see it in the mortality rates, we see it in the different quality treatment surveys, we see it all over. So from my perspective, as somebody that does with this company innovation process again and again, there are a couple of factors here. One, like always, unfortunately, it's money. We need to make sure that there is proper funding for this. The countries of Africa, some of them, they don't have the proper funding to implement those technologies. Even if they have the best intentions in the world, they won't have the capability to introduce those. On the other side, we have also the need to educate the local population. It's not, even if you have really fancy technology and the general population won't be using it, you will fail. So you can invest $1 billion in a process and you can invest in a very fancy technology. But if you don't go hand in hand with local leaders and teach them and educate them and go together with the population, not against, okay? Don't force them, teach them, only then it will actually succeed.
Terrific, wonderful. I think you really touched on some of those critical factors, right? Necessary for AI technologies, which you're right, some of it is really limited on across the sub-Saharan Africa, and there's a lot that needs to be made. Maybe I want Professor Adewale to add some comments and maybe share some policies that you think the African governments could implement to accelerate these applications in healthcare, particularly regulation, diagnostics products, harmonizing cancer collection data, data collection, like you mentioned, and financing. Any, what are your thoughts in that space, Professor Adewale?
Thank you so much, Irene. I think what we have, to me, is a unique opportunity to leverage on technology and also to develop appropriate policies, digital health policies that are favorable, easy to use, and we can also key into the WHO Global Strategy for Digital Health 2020 to 2025, which to me is quite appropriate. And we should also look at some success stories of the African continent. For example, in DRC, they're using AI to facilitate cervical cytology for cancer screening. In Zambia, cervicography being captured using cell phone, and this is translated to the Center of Excellence in Lusaka. And there are quite a number of other stories that we can cite. But what we need will be, one, internet penetration. We need favorable policies. We need power backup. And we also need training. All these can actually be done even by telehealth. You can train people by telehealth. There's no doubt that except we apply technology, we will never be able to close the gap in terms of cancer care. There's a huge gap between Africa and the rest of the world. And as mentioned by one of the presenters, one of the challenges we have is also late presentation. A friend of mine used to say that there are three characteristics of cancer in Africa. They said number one is late presentation, number two is late presentation, number three is late presentation. So if we want to have a shift from late to early presentation, the only way to do that is by applying digital technology.
Well said.
Particularly for diagnosis, also for treatment and palliative care.
Well said. Well, quickly about data. What about data scarcity, which is really the foundational substrate for our AI technologies, and gathering data and curating is a lot of process. And I want you to comment on that, and then we'll follow by Dr. Indo about, I'm curious about whether you could add any innovative AI-driven technologies that are being implemented in Africa. I'm curious about Huron and the work being done there. But
I think the main challenge that we face is the absence of data, particularly population-based data from population-based cancer registry. And when there's no data, you can't plan. When you don't have data, you cannot really allocate appropriate resources. And that's why we have this challenge. So when we have data, there will be a complete transformation.
Yeah.
The cancer scenario in Africa. Data is everything, someone will say. So we need data for planning. We need data for treatment. We need data for even evaluation of treatment, allocation of resources, and also determining cost effectiveness. So data is everything. And to me, this is the time to actually deploy AI, not only for diagnosis, but also for data gathering.
Yeah, good. Dr. Indo, your comments or your thoughts around data?
I think Leo and Professor have brought up very important aspects to like data and cultural sensitivity. And I'd like to give two examples before chiming into what we're doing in Huron AI. So a very prominent example is Chadwick Boseman, who died of colorectal cancer at 44 years. He was diagnosed at 39. At the time he was diagnosed, the guidelines for screening in the US, for doing a colonoscopy in the US, was at 50. Now it has been revised to 45. But when you look at the median age of diagnosis of colorectal cancer in the United States, is 68. So when you do the cost-effective analysis and you look at the epidemiology, then those guidelines would be recommended. However, in a place like Nigeria, a study by the Obafemi Awolowo University found that the median age of diagnosis for colorectal cancer in Nigeria was 50. That's 18 years less than what we have in the United States. So this just really points out that local data is so important, because you cannot use the same guidelines in the United States for a place like Nigeria or Rwanda. And it's not easy to get the kind of data that we want, but we have to think about innovative ways to do it. And that's one of the things we're doing in Heron AI. Our platform connects patients to doctors in a culturally sensitive way, because before we designed any solution, we had to talk to all the stakeholders in Rwanda. We spoke to the oncologists, government officials, the patients, which is the most important factor in this whole nexus. And one of the things that the patients do is they can essentially get surveys, they get like questions about like their side effects, they get treatment reminders, and they use it in a USSD format. So you don't need to have a smartphone, you just need to have a mobile phone where you can use text. But the doctors have a very comprehensive platform where they can comprehensively monitor all their patients. They can see how things are going with every patient. They can easily send messages to their patients. And it reduces hospitalizations, because a lot of the problems that patients would have during their treatments can be addressed in a timely way. So all that patient-reported data is really important, because now, even though there's not a system where doctors are entering all the patients like in a centralized cloud system, that patient-reported outcomes plus the initial clinical data that the doctors enter is already forming what would soon be a population cancer registry. And then we can develop machine learning models to help predict better treatment strategies for patients. You can basically segregate patients and know which would have what side effects. And keep in mind that a lot of the oncology medicines we have today, very few patients of African descent participated in those trials. So we don't understand the full scale of side effects that patients might have. And ultimately, we want to improve outcomes, use this data and perform a lot of machine learning models to be more strategic in predictions or making guidelines that would work for specific populations.
Great, great. So look, it sounds like you've all have touched on the key challenges and barriers, right? It's data collection as well as data privacy, right? It's infrastructure, it's education, it's governance. I want to circle back, start with our CEO, Leo Romanowski, and you've been successful. And maybe we want to talk practicality, right? Whether these investments are worth it. And if it's worth it, what are the right conditions that need to come together to really bypass all these huge challenges? I know there's some countries in Africa, like Ghana and Nigeria, that are moving with these advanced technologies, and it's limited countries. What are some of the right conditions that need to be pulled together to really make this a practical reality? Otherwise, it's just sort of really talking about it and only having a few countries that are leveraging these technologies. We do want to see it scale. We want to see progress. And I'll start with you, and then others can comment.
So first of all, thank you. I will, as I said kind of before, I think that in the end, it starts and ends with funding, with partnership into action, which means that the importance of a local, strong partner that is able to support the company or venture or even like the investment firm that is doing the entire movement. It's a must. So actually, there is like a Goldilocks of terms that needs to happen. So you, as I said, you need money, you need the partnerships, and you need basically the foundation, which are the population, the conditions in the market, and so on. So that's pretty much like what we are looking for. It's in most cases right now in Africa, it's very hard to find. There is a reason why there's only few countries right now in Africa that are actually doing those pilots. And in the end, when you look at and you talk with, let's say, venture capitalists, and you are even like trying to get their interest to invest in Africa, many times it will be a no. And the reason is that, first of all, for them, it's not a classic investment. You know, normally they're going to Western markets or even Asian markets that are more financially robust, and there's like more room, let's say, to move. It's a more dynamic market. There's more finance. There's more to gain. And especially if we are talking about building a profitable venture, which in many cases in the world of medicine, we're not talking about it. We're talking about building an NGO or working together with health ministry and so on. But if we are talking about building a company or creating a situation where there is a company that are working profitably in Africa and is managing, one, to increase the healthcare level of the population and also to profit, that's going to be a game changer. And I think that's something that needs to happen. Right now, I'm still waiting to see that this mega company is succeeding in the African market, but I think it's soon to come.
But you need money to make money, right?
That's correct. That's correct.
So
that's
saying
correct.
that, yeah, they are not investing in Africa because there's no money. What is it that maybe will tip that for investors to really say, well, there's potential, and therefore I'm going to invest in Africa? And I want the others to, Professor Adewale, Dr. Indo, to chime in.
Yes, I think what we really want to see in Africa will be some innovative public-private partnership models. And to me, that will bring to bear resources, both from the public sector and from the private sector. We will benefit from the efficiency, the discipline of the private sector, from the resources that the public sector can also bring to bear. There's no doubt that money is needed. For example, what we've been doing so far has been funded by the American Cancer Society. So there's more need for money. But then we need to look at innovative partnership. And to me, Leo, please come to Nigeria and we'll be able to create the platform for this type of collaboration with Europe.
Awesome. Any other comments on that, Dr. Indo?
Yeah, so what I'll say is, if you're dealing in African countries, you have to be very innovative on your business model based on where the country is. So there are some countries that operate a socialized healthcare system where the government reimburses healthcare costs, and those costs are also matched with development partners. So one would have to look at how the country is structured, how the healthcare financing in that country is structured, to be able to penetrate the market. And to be honest, AI technologies are really expensive. It costs a lot of money to continue to develop. It costs a lot of money to have data scientists on your team. It costs a lot of money for cloud space, because a lot of these technologies are operated on the cloud, as you know. So it's very important that in implementing AI technologies, one would have to go with both an impact and a business mindset. It's for you to scale. That's just the only way to do it. The other way is looking at countries that also rely on private health insurance companies. So South Africa is a very good country as an example. And so in those situations, you would negotiate, you have to show the cost effectiveness of your technology and what they're already doing, and prove to that health insurance company that, hey, you save X amount of dollars and you save X amount of lives, you model it if you implement this technology. So even though the financial situation isn't at par with like Asia or, the US market, there are still innovative ways to get this done, and it's a growing market. It's growing, and people desperately need these technologies to close these gaps. And it's not a magic bullet. Every other thing in cancer control should be going on in tandem, improving capacity, finding innovative ways to finance cancer, like tobacco taxes, etc. But technology should also be a centerpiece strategy in cancer control and closing these disparities.
Absolutely. And I think you did all three of you have made a comment about the data infrastructure, the challenges. There's also workforce, and I believe, Leo, you had touched a little bit on that. And I'm curious about, AI is supposed to augment decision-making, augment, and not necessarily replace. And so maybe a comment on, so the workforce and education needed, right, in medical schools or in health and public health schools, and whether there is any thought, Professor Adewale, in that space to look at not just in the health or practice, but what they're doing to build capacity, right, for technology and AI across the African continent.
Yes, I quite agree with you that we need pre-service training, building capacity, and even a revision of the curriculum of many of American institutions in order to introduce technology-based solutions, digital health, telehealth, telepathology, teleradiotherapy. There are quite a number of things. And so these are new things that will really help to address the human resource gap that we're talking about. But training is key for everything. Without training, one will be completely helpless with some of this. And so we really need to plan. And if we fail to plan, then we're planning to fail. Thank you.
Yeah, thank you. Great comments here. I want to give each of you a chance to, provide some closing remarks or suggestions. What, in your opinion, do you think are the two most important factors that needs to be done, right, to help scale AI technologies, really to, what can be done, sort of immediate next steps, in your opinion? And I will start with Leo, and then Dr. Indo and Professor Adewale. So any closing remarks?
I would say that Africa is an amazing opportunity. I think that it's the last continent that is left unexplored in a way. And the magnitude and the amount of opportunities that we have there in terms of potential technology implementation and penetration, it's super significant. And if we will be able to create the conditions with companies like your own AI and activities in other different medical tech companies and so on, I definitely think that in the end, everybody will win. On the one side, there will be significant amount of companies that suddenly they have an entirely new market that they can profit from. And on the other side, we have an entire population, like an enormous amount of people that will benefit from getting better treatment, long longevity, and better overall health. And that's where we need to strive for. And again, thank you for inviting me.
Great, thanks. And next, Dr. Indo, your closing remarks, or any, what are the highest two priorities that need to be done to help scale these technologies?
So I would say that Africa is the most genetically diverse continent in the world, and it would be a huge mistake to ignore funding data science and machine learning and innovative solutions that can close the cancer control gap. And I would say it's possible. We need to have more innovative financing for healthcare so that it will be more attractive for companies to come and operate in Africa. And we need to fund everything data, from population-based cancer registries to providing grants to train people in data science, because it's critically important to implement these technologies. But again, I say it's very possible. It's already happening even in a small country like Rwanda. And there are several other examples that hopefully would soon scale, and everyone can see that, yes, it's possible. And thank you. It's been a fun panel.
Great. And then we'll end with Professor Adewale. are your thoughts? The top 2 recommendations that you would give.
Thank you. Let me draw an analogy from a business model of a business executive sent to a remote village in Africa where they do not wear shoes. And on getting to that village, he sent a radio message within a few days and said, please, can you transfer me to another country? They do not wear shoes in this village. And they brought in somebody else who said, can you send container load of shoes because they do not wear shoes in this village? So I think Africa presents tremendous opportunity for the application of technology-based solutions in health, particularly AI-driven ones. And to me, it has multiplier as well as opportunities for improvement in cancer care, research, and training. And 2 critical things are needed. One is political commitment and action at the highest level. The other one are, to me, clear and actionable policies on data governance, data utilization, data privacy. These 2 critical issues are necessary to enable us to leapfrog and improve cancer care in Africa and bridge the cancer care divide. Thank you. It's a privilege to be part of this panel.
Wonderful. Terrific closing remarks from all of you. I would like to say thank you. It's also been an honor, privilege to chair and be part of this panel. Thank you all for your insights, for your recommendations. And I hope our participants found this informative, and we hope that we can have future dialogue on how we can really scale up these technologies across the African continent to address cancer care outcomes and disparities. So with this, we'll close and turn it over to the audience. Are we going to have questions and answers after this?
Yes.
All right. All right. Thank you all.
Thank you.
Thank you.
Thank you.